they don't talk about wounds or whatsoever with friends, relatives, whatsoever, or even with the physician. They try to hide that they have something on the foot.
Hello, Ralf. I'm Athanasios Saratzis. I'm a vascular surgeon and I'm an NHR professor of vascular surgery in the United Kingdom. It's really nice to welcome you to this online interview, which we're doing for PVI. So for everyone watching this and listening to this, Dr. Ralf Langhoff is based in Germany and he's an angiologist, and I will let Ralf introduce himself, and then we'll have a quick chat about where we see vascular interventions moving in the near future across Europe and how PVI is connected to all this. So Ralf, can I please ask you to introduce yourself?
Yeah, so my name is Ralf Langhoff. I'm an interventional angiologist based here in Berlin. So I do endovascular treatment primarily, as you may know. So angiologists, we should take care of arterial, venous, and also lymphatic disorders. I skip a little bit the lymphatic disorders because I don't like it that much. So my main focus is on arterial, but we also do venous treatment on the conservative diagnostic basis, but also on endovascular things.
Great, thank you. So Ralf, may I ask you, what do you think is the key challenge that we're facing at the moment in Europe, as well as your environment, in terms of providing the best possible care? Mostly for peripheral artery disease, because I guess that's probably the bulk of what we do, but generally for vascular diseases. So what's the key challenge that we're facing right now, Europe-wide?
So Europe-wide, I think that still CLTI is just a major problem. This is just in terms of patients and in terms of awareness among the possible patients. So most of them are just coming too late, I would say. And it's just not that the referring physicians, I think a lot of them are quite aware of the disease. But still, I think there is a lack that patients are just not aware, especially when it comes to diabetes, that they are not taking that much care of their wounds. It's always a week or 2 or 3 or 4 too late that they're going to show off with their already infections, necrosis, whatsoever. So that's quite a big challenge here. So from the medical point of view, and I would say like the things we are going to suffer from, I always say, and maybe you know, Germany is a poor country. So it is just in terms of endovascular treatment, there are a lot of things we would like to offer to patients, but we are not that much well reimbursed under several conditions, and it's always strategic decisions we have to do to treat our patients because yeah, beds are short, and so all the health insurance system is just and sometimes overloaded, and they are controlling us day and night.
So essentially, you're describing something like a pandemic in a way of CLTI, very similar to what we're facing in the UK, especially in the last 5 years. We've seen an explosion in the numbers of people presenting with CLTI. And what you're saying is that we probably need better awareness, both amongst the public and those trying to refer people to us, so that we can get the referrals in a bit quicker and do something before it's too late. Is that correct?
Yeah, so I think it's just like a huge tide of diabetic patients. What if you just look for the numbers, the healthcare organizations just calculated that was just much too low compared to what happened right now. I think if we talk to diabetologists and vascular surgeons, angiologists and cardiologists, I think they are quite aware of the problem. Uh, I would say like a lot of them, if they are just feeling responsible for vascular disease, definitely they are aware. The problem I think still is just like patients are just not facing the issue. I think they always come too late. It's just totally different. If you look for coronaries, it's so different because when they have something like a disorder of the heart, they are going to show off immediately to a physician. And they talk with their relatives about these problems, but they don't talk about wounds or whatsoever with friends, relatives, whatsoever, or even with the physician. They try to hide that they have something on the foot. So I think it's just something which is a public problem, definitely.
So, what do you think we as healthcare professionals can or should be doing about this? Is it a matter of raising more public awareness? Is it a matter of creating simpler and more streamlined care pathways? What do you think?
Yeah, I think it's just something we to raise public awareness is also cost intensive, I would say. It's something we have to talk to newspapers, to even to TV stations, just to get the message out. Um, there are some of these medical device companies who are just also understanding this message, and they are going out and just try to help out in terms of healthcare professionals talking to patients and just getting this as an initiative to raise awareness. So I think we have to cooperate. In Germany, at least, with the medical societies, we try to look for awareness and get over the medical societies something into the newspapers. And the same is true for medical device companies who also try to help out to launch some articles or stuff like this.
Okay. In fact, in the UK, we've had 4 or 5 companies that have joined forces and are trying to fund a campaign, which I hope will be able to finalize by the end of the year and then try and spread it out across Europe. And when I say campaign, I mean a public awareness campaign about the symptoms of PAD, especially in the earlier stages, so that we can actually do something about it. Okay, that's brilliant. That's very insightful. Can I move you on? We are talking about PAD quite a bit here. Where do you think the next step is in terms of generating evidence for PAD right now? We are seeing lots of quite small studies like registries, a few small scale randomized studies, which probably don't answer the right questions. Where do you think we should be going in terms of generating the right evidence for PAD, both medical treatment and intervention, especially given that you're an interventional angiologist and you can see both aspects of the problem, both the medical treatment and the interventional treatment? What do we do in terms of creating better evidence for PAD?
Mm, mm. So I think we, honestly speaking, we just have to face a problem that device companies, so they are inventing something and they want to test it, and they mostly try to have something head-to-head comparison always is wanted against standard of care treatment. If you look for the below the knee treatment, still there is a huge lack of data because
Yeah.
still standard of care is PTA. So the last trial was PTA against a resorbable scaffold. Question, is this honest or not? Should this not be against maybe a drug-eluting stent? Is this not more honest at the end? And the other question is, so we know that the DCBs, they work quite well on the femoral segment, but definitely there is no really good data for below the knee arteries. Maybe one trial, but nobody really understands why. The problem is probably because it's a vessel preparation. So at the end, you would just have to find a company who is going to invest in vessel preparation plus DCB and compares this with standard of care, which would be PTA, which is probably not honest. So I think it is just like for real evidence, I think you're not finalizing this with one company at all. I think the companies, or we as physicians, probably have to raise money to get really a trial which is maybe not initiated by a company because they have to sell their things they invented, but probably if this would be just like an IIT, and you
Yeah.
get money from different companies, you can really have an honest comparison of actual treatment. What do you think is just worth to investigate, like atherectomy plus DCB compared to, I don't know, a scaffold or whatsoever? Just, I don't know, would be more.
Okay.
And
So what I'm hearing is that we definitely need more evidence in the BTK domain, and we probably need to get together both as companies and as physicians and funders in order to design something that will not just compare apples with oranges. It will compare the best available treatments out there, probably in an adaptive kind of way. So not just focus on what's been around for decades, but look at the newer treatments and try and compare best to best, really.
yeah, just to be a little bit at the end independent of what is understandable and reasonable, but the company has to just they have a message, they have to sell something, but it's not generating evidence at the end.
Okay, yeah, that's very important. Again, we can't just rely on funding from just industry forever. It will end up in very biased studies, like it or not. Great, that's a very good point. Now, may I ask you, coming back to PVI, what are the main things that you enjoy about PVI, and why should someone join conference, join the symposium this year?
I will not name the location, which is also fantastic.
Yeah.
I think I was expecting your question, and I think honesty is just one thing I totally like about PVI. It's just like that we just have we should discuss, and there is room for discussion, which is different from other conferences. And so I like this moderator interaction with the lecturers, because it is some people may find it a little bit too offensive, but I don't think it is. It's just like it's friendly fire. It's just like
Yeah.
good discussions, and I would say that this is going to lead to honest discussions at the end about evidence, about real practice, about yeah, people have to really think of, when giving a lecture, that a moderator can jump in and ask you questions, and you have to be honest and just try to answer really how you think it is. And that's just a good format, I would say. I like it.
Okay, fantastic. So I hope to see you in a few months in Paris, face to face. And for those who are watching the video, we'll see you all in Paris. Feel free to come and find us and have a chat about key issues around CLTI and PAD care. And there's going to be loads and loads of talks on this. Very interactive, like Ralf just mentioned. So see you in Paris in a few months.
Yeah, looking forward to it. Have a good summer.